bit, but I personally think that after about a year, you're looking at simple mastectomy, because that thing will go down to a certain size, and then it's so hard and granular that it's almost impossible to get rid of the rest of it. I'm not saying impossible, but my experience has been that simple mastectomy after 6 months to a year on the cantron, and you refuse chemo and radiation, and you're going to be fine.
Right now, my doctor has me on protonics. I have a sarcoma, and they want to give me Gleevec for this. Is this protonics a good thing to be on?
Gleevec? What disease do you have?
The cancer is sarcoma.
Sarcoma? I'm not ready. The first time I came to the Hope meeting 2 years ago, the first lady I met when I came in the door said she had leukemia, and she took 2 capsules of Gleevec and threw up her guts, you know. And most people can't tolerate Gleevec. Gleevec was supposed to be the great panacea, the great one that cured the cancer leukemias, but no side effects to normal cells. And it really has gone down the tube. I personally wouldn't recommend it for sarcoma. I think you're going to have a lot of abdominal upset. It does have an effect on the immune system, like other chemos do, and I personally think it's been a total failure. But it's recommended only for leukemias as far as I know, but it was the great one touted as the great cure, you know. There's 286 great cures now in traditional medicine being tested, and all of them have the same format, and all of them are bound to fail. I wouldn't recommend it. There is one indication for chemo, by the way. I disagree. I tell people in acute childhood leukemias and some lymphomas to use a little chemo. We have to do that when the crisis occurs. If we have a leukemia white count above 300,000 and it's life-threatening, we have to give a little chemo to bring that count down to a normal range, and then the cantron and the other products will hold them in remission. But that's an indication. And Jim Sheridan and Ed Sobchak also said that about leukemias. Acute leukemias require chemo once in a while to pass life-saving measures, and then go and get them on the program, or even while they're taking the chemo, and ease them into remission, and we can hold them into remission then. But sometimes we have to use a little bit of chemo for those leukemias.
Dr. Maris?
Yeah.
I wanted to know, I have breast cancer, and it's probably about the 4th time I've had it back, actually, and it's inductal, and it's starting to come out of the duct this time, where before it was not. First time I had done radiation with a lumpectomy, and yes, I did get it back. I also got skin cancer on the breast, probably from the radiation, and I got it back in the breast 5 years later. First time around, and the second time I did natural therapy, went away for 5 years, and now I do have it back, and I'm taking a cantron now for 2 months. And my question was in regards to chelation. I started chelation. Does that change the vibrations or anything with that? They have recommended vasectomy, but I am not willing or ready to go down yet. I still feel definitely naturally by changing the diet and doing what I can that I still would have a good chance.
Okay, regarding chelation, chelation's fine, but don't take hydrogen peroxide IV with it. Hydrogen peroxide, a lot of people use hydrogen peroxide. It would be great if it worked, but in fact, instead of getting more oxygen into the cells, it produces hydroxy-free radicals. And Ed Sobchak especially warned against that too. I've seen people die from intravenous hydrogen peroxide given during chelation. And maybe I'm going to disappoint you, but I recommend simple mastectomy in that case.
Dr. Maris, when I take my cantron, I take it with a little bit of distilled water, but I also take the Willard's water. And so the distilled water is a negative charge water, but the Willard's water is a catalyst water. So it seems like one is working against the other. You recommend that you take the Willard's water, but as a catalyst water, isn't it kind of increasing?
Don't take the Willard's water the same time you take cantron. They should be taken at least a half hour apart. And don't mix cantron with Willard's water. No.
Dr. Mears, I want to know what your,
Okay.
how you feel about taking oral chelation with cantron. I have two parts.
Oral chelation is fine.
Okay. On an empty stomach or with food?
Don't take it at the same time you take the cantron, but I would personally, I take the oral chelation personally with enzymes. At the same time, 1 hour before, 2 hours after, and it'll work better. Enzymes really do help products work better.
I've been eating almond butter, and there's a lot of sugar in that, but there's no sugar added. How about that? And what you say no salt? I'd like to know about both of those.
No added salt. You can use a little bit of sea salt. I've changed my mind a little bit about that salt bit, by the way. Just don't use sea salt, but don't add too much. Use just the salt that's in a lot of food, but don't add a lot to it. If your kidneys are all right and everything, salt's not going to